Recently, almost 350 frontline healthcare workers, including nurses and doctors and union workers with SEIU Local 73 and the NNOC, which represents nursing staff along with tradespeople from a number of other collective bargaining units at Cook County's 3 public hospitals, have been issued pink slips from the Cook County Health and Hospital System Management. The layoffs include 35 nurses at John H. Stroger Hospital, almost 100 clinical staff, including nurses at Oak Forest Hospital, and more than a dozen nursing staff at Providence Hospital. The Health and Hospital System Independent Board plans to close or consolidate clinics, reroute patients to private clinics or so-called quote hubs at Cook County hospitals, and they also plan to eliminate inpatient services at both Oak Forest and Providence Hospital, which has the second busiest emergency room in the area, according to Cook County Board President Todd Stroger during a press conference on October 26, 2009 in front of Stroger Hospital, named in honor of his father. Here's more of what Stroger and the ward Alderman Walter Burnett Jr. had to say about this.
Elected officials and community residents support the outstanding union women and men who are the frontline workers for hundreds of thousands of people who use our healthcare system every year. These workers are the backbone of a public health system that provides vital services to county residents, regardless of their ability to pay. And it's an outrage that we now have to fight to save the jobs of those same tireless workers that now not only provide great service to our healthcare system, but have worked with my administration to keep these services going through difficult times.
That's right. That's right.
All right. This latest round of cuts from frontline workers is a thinly veiled attempt at privatizing a vital public service.
That's right.
They're trying to bust the union.
Yes.
And it's not going to happen on my watch. We created a blue ribbon committee. And what did that committee say? It said we needed more money. No, not boo to them. We haven't gotten to them yet. The blue ribbon committee said we need more money to run this system. And what did we do? We brought more money to the table.
That's right.
Dick Durbin helped me put that committee together. Valerie Jarrett was on that committee. Dr. Goodman from Rush was on that committee. The man from Terry Mason. Dr. Terry Mason was on that committee. We brought the money to run our system. In these bad economic times, it is not the time to say, let's cut our services. Let's get rid of our workers. We don't need any clerks or nurses. We don't need the doctors. How can we say that?
That's right.
This is when we need them the most.
That's right.
People are losing their jobs every day.
That's right.
People get sent from the hospitals to Stroger Hospital every day. Here's your x-ray. Go over to Stroger. They'll take care of you. We need our workers.
Yes, that's right.
We need our system.
Yes.
We cannot allow and will not allow
That's right.
the board to pay millions of dollars to outside consultants.
That's right.
Have them come in and tell us, no, you don't need this. You know, downsize. Be small. Be like the private hospital. We don't want to be like the private hospital. Our system is here to help people.
That's right.
And as long as I'm the president,
That's right.
and I'm sure people with me today will be talking to the commissioners, all 17 of them, to tell them that we cannot allow this to happen.
That's right.
No, sir.
I don't care what the board gives us, the
That's
Health
right.
Systems Board, we have to make sure that we keep our workers intact, that we
That's
keep this system intact, that people have somewhere to go. So I'm telling you now that I'm with you.
That's right.
We will fight this,
That's right.
and we will win.
We want to hear from the union officials, but Alderman Walter Burnett of the City Council.
I'm proud to be here with hard-working people in the city of Chicago to represent all of the people in the city of Chicago who cannot afford health care. Right now, our President of the United States is trying to put in a public policy. How can you put in a public policy and you don't have people to work at the hospital? This is so ironic. I remember in 2007 standing here with several aldermen, with President Stroger, working with that blue panel, working with Dick Durbin, coming up with the changes and recommendations to make the hospital better, to be able to collect the dollars from Medicaid and Medicare. How are you going to collect dollars from Medicaid and Medicare if you don't have people to work? It's ironic that people would stand up and they would fight for other sensitive offices, the sheriff's office, the state's attorney's office, but when it comes to these offices like the county hospital, where you have nurses and doctors and clerks who take care of women and minorities and immigrants in our city and our county, no one's standing up here to fight. These are people too. This is just as important as anything else. They're talking about cutting hospitals, Providence, Oak Forest, all of the hospitals in the suburbs. You mean to tell me we're raising CTA fees, we're raising all of the transportation fees, but at the same time we're going to cut out the hospitals that's convenient for the people in the south suburbs and on the west side. This is not private industry.
That's right.
This is taxpayer dollars going into this hospital. Taxpayers' dollars is not used to make profit like private industry. Taxpayers' dollars is used to serve the people.
That's right. Serve the people.
If public dollars can't serve the people, then who will?
That's right.
So it's a difference. This is not a private hospital. Those that sit on the board that work for private institutions, you gotta wake up. This is a different situation. This is a public hospital. The public comes first, not profit.
That's right.
From what I understand, some of those folks are making over $400,000 a year. And we're gonna cut out nurses. People complain when the lines are long because so many people are out of work now and they need public health. So many people right now are concerned about the H1N1. Where do you think those people go? Where are they gonna go? Now what are they gonna do if they come here and we don't have the nurses? We don't have the clerks. We don't have the people in place to help them. How are they gonna get served? How are their children gonna get served? How are those women, those pregnant women gonna get served? We need that board to turn this around, pay attention to the people in this county, take care of our indigent people. They're just as important as the sheriffs locking up people. They're just as important as the state's attorneys putting people in jail. They're just as important as anyone else. We need to take care of Stroger's Hospital, and I stand with Todd Stroger. Todd Stroger has took a whooping for standing up for this hospital.
That's right.
Todd Stroger has took a beating for making sure policies are in place and money's in place to make sure that this hospital operates. Now he put the money in, and now they want to cut people out.
Get rid of the board.
This is not right.
Get rid of the
This is
board.
not right. It's not right. It's not right. Let me hear everybody say it's not right.